7 recommendations you should follow if you want to get rid of hemorrhoids. Chronic constipation, abdominal overstretching or poor eating habits are the reasons why hemorrhoids can develop. This problem, which is characterized by the dilatation of the venous structures that are located in the anal canal, has become one of the most common ailments. Follow these recommendations to get rid of hemorrhoids. In their early stages, hemorrhoids may cause mild discomfort such as itching, inflammation of the skin and a bit of bleeding in the stool. However, they can also present other complications, causing fleshy masses to pop out. As you may imagine, these can be quite painful. There are medications that can help speed up your recovery. However, it's important to consider other recommendations to properly treat them while they're being cured. In this article, we've compiled the 7 best ones. What are the causes of hemorrhoids? Basically, the veins around the anus tend to expand due to pressure. Often, the main triggers of hemorrhoids are straining during a bowel movement, remaining seated in the bathroom for a long time, having constipation or chronic diarrhea. Being overweight or obese. Being pregnant. Having anal sex. Eating a diet low in fiber. Symptoms of hemorrhoids. The milder forms of hemorrhoids do not produce severe symptoms. In general, patients experience an uncomfortable sensation in the anal region. Signs and symptoms may include bleeding that does not cause pain when stool is passed. Itching and irritation around the rectum. Pain and discomfort. Inflammation around the anus. A lump near the anus. Recommendations for preventing and treating hemorrhoids. (1) Increase fiber consumption. Fiber is one of the essential nutrients that help improve bowel movement to facilitate the evacuation of stool. Make sure you eat foods like fresh fruits, green vegetables, whole grains, seeds and nuts. Two. Drink more water. Dehydration is one of the factors that influence constipation and hemorrhoids. Therefore, to control this problem, it's essential to ensure optimal water consumption. Drink at least 6 to 8 glasses of water a day. If you prefer, consume it in teas or natural juices. 3. Avoid irritating foods. There are some irritating foods that can worsen the symptoms of this condition. Their consumption affects the digestive activity and worsens the irritation of the skin around the rectum. Make sure to avoid spicy or greasy foods, foods that produce a lot of gas, sweets or sugary foods, cured cheeses, industrial meats or sausages. 4. Do not strain. Hemorrhoids often come with difficulty in evacuating feces. For this reason, patients who suffer from them tend to make undue efforts when going to the bathroom. It's important to avoid straining or holding your breath when trying to go to the bathroom. This situation increases the pressure on the affected veins, increasing their dilation. 5. Do physical exercise. To avoid the reappearance of hemorrhoids, it's a good idea to do physical exercise. Staying active regulates intestinal movement and decreases the pressure that is produced in the veins of the anal area after staying seated for a long time. Dedicate between 20 and 30 minutes a day to an exercise activity. 6. Caring for anal hygiene. http://i67.tinypic.com/2d0cmz7.png. For an optimal recovery process, it is necessary to have good anal hygiene. The area should be cleaned with warm water and neutral soap, especially after going to the bathroom. Excess washing can cause an imbalance of the natural fatty layer of this region of the skin. For this reason, using an anti-hemorrhoidal ointment or Vaseline is recommended.